Dr. Angris, could you state your full name for the record, please?
Dr. Alfred Angris.
And could you please tell us about your credentials?
Sure. I'm a pathologist, qualified in morbid anatomy, clinical pathology, and forensic pathology. I have my MD from the University of Chicago School of Medicine and my internship in pathology from the Northwestern University School of Medicine and residency in clinical pathology from the University of Chicago.
Now, are you a member of any professional organizations?
Yes, the American Medical Association, the Cook County Medical Society of Illinois, and the Illinois Pathological Society. And
do you teach in the area of pathology?
Yes, I'm Chairman Emeritus and Professor of Pathology at the Pritzker School of Medicine and also visiting professor at the University of Illinois State School of Medicine.
Are you published in this area?
Yes, over 200 articles in the area of pathology.
Your Honor, I'd like to certify this Dr. Angris as an expert witness. Now, is it true that you examined Mr. Ramirez with regard to the injuries he sustained in the early morning hours of December 7th, 1996?
Yes.
And did you also review the medical records of Cook County Hospital where he was treated that morning?
Yes, I did.
And what can you tell us about your findings?
There were two significant findings during my examination.
And could you tell us about your first significant finding?
Yes, the scar on his shoulder from where the bullet entered his body had jagged and irregular edges.
And what is the significance of the scar having jagged, irregular edges?
This means there would have to have been some mobility on the part of Mr. Ramirez as the bullet was entering his body.
And did Mr. Ramirez, at the time you examined him, did he explain to you how he sustained the injuries?
Yes, he did.
And what did he tell you?
He said that he had been knocked into the ground and was in the process of getting up from a horizontal to a vertical position when the bullet was fired.
All right. And with regard to your second finding, what was the subject matter of your second finding?
The direction that the bullet took through his body.
Could you please indicate that for the jury?
Yes, certainly. At first, the bullet entered in the back of his right shoulder here, and then it bounced off the scapula, the shoulder blade, and then traveled downward where it hit the sternum, and then bounced back into the top of the pericardium lodged in his heart.
Thank you very much. Now, was the path of the bullet that you just indicated for the jury, was that consistent with what Mr. Ramirez told you?
Yes, it was.
Thank you. No further questions.